Good morning, everyone. Thank you all for joining this insightful session. I am Dr. Priyanka. Today, we will be talking about a very important topic, menopause. Before we begin with the session, I would like to talk about our organization and about the topic as well, while introducing our speaker for the day. Apollo Ayurved is a chain of Ayurveda hospitals, leader in quality systems driven Ayurveda medical care that focuses on the root cause diagnosis and management of serious chronic diseases. Founded in 2005, we have treated over 350,000 patients to date, employing an end to end protocols driven classical Ayurveda approach to address a diverse range of healthcare needs, cover medical specialties ranging from neurology, orthopedics, and metabolic disorders to respiratory disorders, gynecology, pediatrics, dermatology, and beyond. Our approach seamlessly integrates the time-tested practices of classical Ayurveda, Ayurveda Chikitsa, that is medical management, with contemporary medical methodologies, ensuring the delivery of well-aligned and effective medical interventions. Currently, Apollo Ayurved operates in Bangalore, New Delhi, Gurugram, Chennai, Kochi, and Almora with 12 operational centers. Excellent facilities at Apollo Ayurved are complemented by an exceptional team of experienced, highly qualified physicians and Ayurveda nurses trained in accordance with NABH standards. Our team includes MD Ayurveda qualified physicians from leading institutions of higher learning in Ayurveda. As we gather today to talk about this topic, Ease the Menopause, you will learn and gain some insights from this session, which are practical strategies to navigate this transformative phase of life. You'll also get to know some tips about managing common menopausal symptoms, understanding what kind of hormonal changes that occur during this phase, and how to adopt an Ayurveda approach for optimal well-being. We have with us today Dr. Swetha Suvarna. She is the medical superintendent and lead physician at Ayurveda's Stri Roga and Prasuti Tantra department at Apollo Ayurved. With over 18 years of clinical experience, Dr. Swetha specializes in addressing common women's health conditions and guiding women through the challenges of menopause with expert care and support. Dr. Swetha brings a wealth of expertise to provide exceptional care for women's reproductive health. I welcome you, Dr. Swetha, to this session, and I'm looking forward to hear your insights about menopause and how to navigate seamlessly in this transition phase. Over to you, Dr. Swetha.
Thank you, Dr. Priyanka. Thank you, AyurVAID, for creating this platform for an interaction on a topic which is so interesting and so relevant for most of the women out there. Menopause is a topic which is mostly talked about, but not focused on, I would say, not particularly cared about. So let's draw our understanding to what are the serious symptoms, what do we need to be careful about, and how Ayurveda eases the pause that menopause gives a woman. Thank you all the participants for joining in. Give me a minute to share my screen.
Yes, definitely, Doctor. I would request the participants to post any questions, any queries that you might have during the session or after the session in the Q&A section here. You can see a small question mark on your panel. You can post your questions there. I will take it after the session and Doctor will address the queries as well.
Dr. Priyanka, my
Yes.
slides are seen?
Yes, perfectly well. You can definitely begin, Doctor.
Yeah. So, good morning, everybody. Once again, welcome to the session on Ease the Menopause with Ayurveda. As I told you, this is the most talked about topic. So, let's just see whether there was a mention of Ayurveda in Ayurveda about menopause. Definitely, Ayurveda mentions about menopause, but it mentions about it as a physiological process, not as a disease or not as a condition which needs treatment. So, in Ayurveda, it is called as Rajo Nivritti, which is a normal physiological process that a woman undergoes as she is aging. This might be probably because of the diet, lifestyle, and all the dinacharya or the rutucharya, that is the daily regimen and the seasonal regimen that the women used to follow. Maybe they were not prone for the symptoms that we see in today's life. But if we see, when was this term menopause and the menopausal symptoms coined as a diseased term or something which was not normal, we can see that the awareness of this can be talked back till the ancient Greeks, where the term men means monthly or related to moon, and pavan means to cease or stop. So this was the understanding in the ancient Greeks, where they thought that the women lunar cycle or the monthly cycle would end at particular time and age. And there were a lot of myths that were associated to this menopause. To an extent that women were locked up. There was a principle they used to follow as lock her up. And there were so many things, so many myths associated, thinking that women goes hysterical after menopause. The major function that she was supposed to do, which is the reproductive, is already over. And now that this is the phase when she is not cared much or not supported much. From that stage of ancient Greek, we have had a lot of changes in understanding of menopause with the modern technology, with the modern medicine, and a lot of changes that we have brought into our lifestyle. There has been a lot of understanding about menopause. But at the same time, this is something which has been neglected by majority of the women, because some certain times the symptoms are not very bothering. So uh, let's understand a little more deeper about this topic. So when we say menopause, it is nothing but when the ovaries stop releasing the eggs or producing the estrogen, which it used to do previously. So it's a phase in women's life where the hormonal changes sets in. So when is a woman told to have attained menopause is when her menstrual cycle has totally ceased for almost 12 consecutive months. That is when the woman is considered to be in a menopausal phase. So before this menopause, before a woman attains her menopause, there are different phases in which this menopause sets in. That is premenopause, perimenopause, menopausal phase, and the postmenopausal phase. So when we say premenopause is the stage which runs for years together, say 5 to 10 years in a female, where there are some hormonal changes happening, but there's no evident symptom, and the woman is still menstruating. So this is a phase. In some women, it can run up to 10 years also. So this is a phase when the hormonal changes has set in, but without any obvious symptoms. Next is the perimenopausal phase, which goes up to few months to about 3 to 4 years in some of the women. So this is a phase when the hormonal stages has set in with the symptoms, with some obvious symptoms. But still the woman is menstruating. Either there is irregular cycle or increased flow or amenorrhea for some period and then again menstruation. So all the symptoms are seen in a perimenopausal age. Next comes the menopause, when there's a lot of hormonal change, the menstruation has ceased, and the symptoms are very clear-cut and obvious. Next comes the postmenopausal changes or the postmenopausal phase, where because of the hormonal change, there's a lot of changes in the body in terms of osteoporosis setting in, or that is the bone health becoming weak because of the calcium. And also it can be dryness in the skin. All the symptoms because of hormonal changes are seen in the postmenopausal phase. These are the phases in which the women transits through her menopause and menopausal phase. So now let's understand what are the changes that a woman undergoes during all the phases of her menopause. The first and the foremost that mostly talked about symptoms are the vasomotor symptoms like hot flushes or night sweats. Everybody talks about it. Everybody is aware about it. But the problem lies here because these are the symptoms which are mostly neglected because it is not affecting one's daily routine until unless it is in a very severe degree. But is it safe to do that? No, it is an iceberg theory because there's a lot deep into the symptoms and the changes that the body is undergoing when these symptoms are shown. Maybe to bring in that awareness, there's a lot of work happening around us. Even WHO has started World Menopause Day every year in the month of October to bring about this awareness. In fact, the theme of Menopausal Day for this year is cardiovascular system. That is to bring in the awareness that it is not only hot flushes or it is not only a small mood swings that the woman goes through and she needs to just put up with it or just it's a transition phase and it is going. No, there's a lot more happening. There's a lot of cardiovascular risk. There's a lot of systemic diseases that can happen. So this awareness is very important. And these are the symptoms for which a woman can seek help. And definitely there are a lot of changes that can be brought about just by some diet and lifestyle changes, which we'll talk as we go further in this presentation. So that is about the vasomotor symptoms. And then talking about the general appearance, there's the skin loses the elasticity and becomes thin and becomes wrinkled. The hair becomes dry and coarse. The luster is lost. Digestive capacity becomes weak because the motor activity of the digestive system becomes sluggish and the intestinal movements become sluggish. So women can start experiencing constipation and symptoms like this. There's a lot of psychological changes that happen because of the hormonal changes in the body. There can be mood swings, irritation, trouble in focusing, depression. All of the psychological changes can happen at different ranges, different degree of presentation. Urinary symptoms can happen because the hormone estrogen was not only for the reproductive phase, but it was also doing a lot of other function, which was maintaining a lot of other system functions as well. So now that it is depleted, there's a lot of thinning of the bladder and urethral lining. So the women can experience repeated increased urination and repeated or recurrent UTI symptoms. And as I also already mentioned, there can be involvement of cardiovascular system. What happens is when the estrogen is reduced or is deficient in the body, the bad cholesterol or the HDL cholesterol starts increasing, which is one of the precursor for a cardiovascular system diseases. And also the antioxidant properties in the body goes low. So these are all contributing to the cardiovascular diseases. Talking about the skeletal system, there's less calcium absorption happening in the body, and that is why leading to loss in the bone mass and leading to osteoporosis. Also, in general appearance, there can be a weight gain, which is happening, and the weight and the fat deposition particularly has a pattern of deposition around the hip, around the waist, or in the buttocks. These are all because of the metabolic changes, one, and also because of the emotional or the psychological variation that the women goes through. There can be changes in the voice as there is thickening of the vocal cord. There's definitely a change in the metabolic process that is happening in the body, leading to hyperlipidemia in the blood. And the major changes that happens are in the genital organ. The uterus starts shrinking because it is maintained by estrogen and progesterone. Now that these hormones are reduced, it starts shrinking. The breast fat starts becoming flabby and pendulous, and the vaginal and the cervical secretions decrease. That is why there is dryness of the vagina happening. The ovaries become smaller. On the other hand, instead of secreting estrogen, the ovary starts releasing androgen. So you might have noticed in older women, there is appearance of facial hair and male pattern of balding. All this is because of the androgen that comes in the menopausal phase. And also there is dryness of the vagina because of the lack of thinning of the vaginal mucosa and lack of secretions in the vagina, which makes the sexual intercourse very painful and dry vagina. Other symptoms can be insomnia, fatigue, palpitation. Palpitation means one can hear their own heartbeat louder. They can feel the heart beating fast. That is called as palpitation. All these are the symptoms that can happen to a woman at a varying degree of severity. Let's talk about how this severity varies when we come to the next part of the presentation. So these are the symptoms that are seen. So what are the options of treatment? Is there are some exercises that one can do, the Kegels exercises. There is hormone replacement therapy that is available. So these are the options that is there in the standard system of medicine. Now, when we come to Ayurveda, let's understand how Ayurveda understands menopause. And as I already told you, Ayurveda doesn't consider menopause as a disease state or a process of disease state. It considers Rajo Nivritti as one of the physiological process that the women goes through. So, but of late, we have seen that all of us have moved from that diet, lifestyle, and the healthy habits that are followed in terms of daily regimen or the seasonal regimen. So now is when we have started seeing there's a lot of menopausal symptoms or the syndrome. So there is a coin term that has come up in the recent practice, that Rajo Nivritti Anubandhaja Vyadis, or diseases related to Rajo Nivritti or menopause, and or the diseases because of menopause or the symptoms because of menopause. And how does Ayurveda manages this? The whole understanding of Rajo Nivritti is based on the doshas. The three doshas are mainly considered as the any variation in them as the seat of the disease. So and also Dhatu simultaneously getting involved. Let's just understand how and what it is. So human body is told to be governed by three doshas, that is Vata, Pitta, and Kapha. When these are in equilibrium, that is when you have a healthy status. And same holds good for a woman who is towards her menopausal age as well. But now, as we were talking about doshas, each individual has a prakriti, that is a typical nature of the body, which means they are governed by one of these doshas, either Vata or Pitta or Kapha. Now, let's see the symptoms of menopause. Okay. So when I told you there is a nature for the body, that each individual can be either Vata Prakriti, Pitta Prakriti, or Kapha Prakriti. That means if I have a variation of Vata more in my menopausal age and I am a Vata Prakriti person, then I might have the symptoms related to Vata which are present more. I told you how the severity of the symptoms happen. This is why the severity of some symptoms are more in some patient, severity of some symptoms are more in another patient, or totally the symptoms are very mild for some of the women. So this is what happens based on their prakriti. If a woman is Vata Prakriti, and then her Vata is vitiated or aggravated or disturbed in her menopausal age, then she will end up having more of Vata symptoms. Same with Pitta or Kapha. Now, to understand what does that mean? So the symptoms, whatever we saw in our previous slides as the vasomotor system, the skeletal system, the cardiovascular system, all of this can be distributed in the three understanding of Vata, Pitta, and Kapha. The first one is talking about the Vata dosha related symptom. That is nervousness, anxiety, mood swings, vaginal dryness, loss of skin tone, irregular periods, insomnia, hot flushes, constipation, palpitation, bloating, and joint pain. All these are because of Vata vitiation in the body. If a woman is Vata Prakriti and has Vata vitiation, then these symptoms will be in a very high degree of presence. If a woman is of Kapha Prakriti and a little bit of Vata vitiation is there, there's a milder presentation of symptoms. The same in Pitta. If Pitta is more, then there can be hot temper, anger, irritability, feeling hot, more of hot flushes, night sweats, excessive bleeding, urinary tract infection, skin rashes. These can be the symptoms in predominance of Pitta. Whereas in predominance of kapha, there can be weight gain, lethargy, fluid retention, laziness, or loss of interest in activities, depression, or lack of motivation, slow and sluggish digestion and metabolism. These are all when pitta when kapha is associated, then these can be the symptoms. Now, why is this understanding very important? Because the management of the menopausal symptoms is based on this theory, exclusively on this. So, how does Ayurveda manage this? Whether it is Vata, Pitta, or Kapha, invariable of that. How does the management happen? As I told you, the basic principles, because in the Ayurveda classics, we don't find this as a disease. That means we have deviated from our ahara, vihara, and achara. That means our diet, lifestyle, and our involvement in emotional and other activities. So how do we correct it? Based on the doshas, we correct it. For a simple example, in ahara, if a person is having more symptoms of vata, like nervousness or palpitation or constipation, in those patients, we need to see that the vata factors like too much of activity or too much of travel or too much of exposure to AC. All these are the vata aggravating factor. The women need to avoid these viharas or the acharas that she is following. In terms of ahara or the food, she needs to avoid food which are very cold or which are reheated, which are multiple times put into the fridge and taken out, reheated and eaten. All such foods aggravate vata. Activities like too much of travel and all this activate vata, and emotional stress or too much of anxiety, all this again vitiate vata. So women needs to see that there is a lifestyle, diet, and activity change that she brings about. If the symptoms are mild, the symptoms can vanish only by doing these kind of management. There is no need of treatment, or there is no need of any panchakarma therapies to be done. But if the symptoms are more, if the patient is having the same prakriti, or the woman is having the same prakriti and is having the same dosha which is aggravated, then there might be a need for Ayurveda treatment in terms of oral medication or changes in the some preparations which can be taken as a supplement in the food also can help in some of the women. If the symptoms are still more severe and also include psychological changes, then we can include yoga and meditation into the practice, which will help ease the symptoms of menopause. Now, if the symptoms are on a very high degree and the patient is having a severity of the symptoms, that is when we will require some of the Ayurveda Panchakarma therapies or the Ayurveda Panchakarma procedures to help reverse the body from the process of diseased condition. So what do we do in Ayurveda Panchakarma therapies is we do some external treatments like oil massage can be done. There can be a Shirodhara which is done if there is too much of stress to the patient. In case if there is other morbidities involved, like metabolism is hampered, in those cases, the panchakarma procedures like basti can be helpful. In women where they are having profused bleeding or menorrhagia, in those patients, a virechana can be helpful. These are all the treatments which are adopted based on a particular condition or based on the certain degree of the disease that the degree of the changes that the woman is going through. So these are the lines or the modes of management of menopause in a woman based on what is the presentation, what is the body type of the woman, and to what extent is the menopausal symptoms being present. Not that everybody will get the same treatment, because each individual body is different. So this is a basic understanding of how menopause can be easily managed right from your diet, lifestyle, your activities, oral medicines, and yoga and meditation, along with some panchakarma therapies. Now, most of you might be thinking, is HRT required, or can we manage it only through Ayurveda? Definitely, you can manage it only through Ayurveda. That is because this is as we already discussed, this is a physiological process. And if the body is supported during this physiological process by providing the right kind of food, right kind of supplements, then you would not require a hormonal replacement therapy or a HRT. Thank you. So any questions you can ask.
Thank you for this wonderful session, Dr. Swetha. It was really very insightful. It had really all covered all the points which are needed. And as you said, yes, it is a physiological process, and Ayurveda definitely supports it very well. And I would definitely recommend all the attendees who are here to ask their questions related to the session. Doctor, we've got some questions. Can we begin with the Q&A?
Yes, Dr. Priyanka, go ahead. So,
So
I check it on the chat box, or you will call them
I
out
will
for
read
me?
it.
Okay.
I will do that for you.
Yeah.
So we have a question from Dr. Rakesh. What would be the secondary level symptoms post-menopausal?
Okay. So, as we told, thank you, Dr. Rakesh, first of all, for the wonderful question that you have asked, because rightly so, as I told you, there might be the initial symptoms which are just the peak of the iceberg. The secondary symptoms are the most severe or the most attention drawing symptoms that can happen and can lead to systemic diseases. So I told you there can be hot flushes. These are all the symptoms which are neglected by most of the women, but these have a relation into the deeper system. Like there can be cardiovascular system that can get involved, as there can be hyperlipidemia. They can also the women might undergo some of the changes in the urinary system in terms of recurrent UTIs, which again leading to the further complications. And also there can be an effect on the bone tissues, as it can undergo osteoporosis, again leading to other next level of osteoporosis symptoms. So the same in terms of psychological symptoms. There can be a it can range from mild irritability or lack of focus to an extent of depression. So each of the small symptoms, what we saw as the tip of the iceberg, can have a deep-rooted systemic illness, which can be coming up if not attended at the right time with the right management or the right approach. Hope that answers your question, Dr. Rakesh.
Yes, doctor. And Dr. Rakesh has a follow-up question for the same. Will the treatment in Ayurveda be symptomatic based on the cause, which is the ovaries and hormones, as there is no reference in Ayurveda? So, what could be the possible medications?
Okay. So the treatment, the line of management definitely will not be symptomatic, because we are not trying to supplement estrogen hormone or progesterone hormone. We are trying to understand the body as a whole system. As I told you, we are diving deep into the doshas and seeing what are the doshas which has vitiated, and we are seeing what are the dhatus involved. And in some cases, when there is metabolic symptoms and all this presentations, there is definitely a state of ama which is there in the body. So the management will be focused on this. Based on this, the treatment line of treatment will be decided, whether it is going to be just the correction of some of the diet and lifestyle, or whether it is going to be some oral medication which will just help the doshas to come back to their normal. In some cases, it can be just a oil abhyanga which is suggested to the patient, because if there is a mild vata variation, that is all is required. If the patient is having dryness of skin or something like that, in those cases a mild abhyanga can be advised. But in cases where there is ama, or when there is higher level of doshas involved, and in those cases is where we opt for a panchkarma therapy, and definitely not a symptomatic relief is what we are looking at when we are talking about an Ayurveda management.
Yes, thank you for that answer, Dr. Swetha. There's another question from Dr. Smitha. After how many years of menopause, if a woman develops menstrual flow and USG shows endometrial thickening, how to proceed in such cases?
Once a woman has attained menopause, that is 12 consecutive months of no menstruation, and then if she starts menstruating or if she starts showing spotting, it has to be evaluated properly, because this might be a first symptom of other systemic illness or a first presentation of some malignancy. So any bleed, that is postmenopausal bleed, needs to be evaluated with utmost care to rule out cancer or malignant state in the uterus or in the cervix. Has to be properly evaluated. Any menopausal bleed requires high level of focus and requires proper investigation to rule out other associated diseases.
All right, thank you, doctor. Another question we have is, can you please throw some light on medical management?
So when we are talking about medical management, basically, as I told you, first line of management is dosha. Next, if there is ama, then correct. If there is ama which has to be dealt with, then that also becomes a priority along with dosha correction. Next line would be dhatu pusti, then coming up with rasayana, and also well-being of the manas. These are the chikitsa siddhanta that has to be followed. So when I'm talking about correction of dosha, there can be some of the cases it can be a just correction of ahara or vihara. For example, if a patient or a woman who is having menopausal symptom is having excessive bleeding and is having a prakriti, then obviously a correction of diet and lifestyle, like advising her to avoid spicy food or advising her to avoid sour food, advising her to keep away from oil fried, and keeping her mental calmness, all this will help bring in a change in the women. So this can be some of the line of management in milder presentations. But if the woman is having ama presentation, or if the woman is having hampered metabolic functions, if she is having weight gain, if she is having dyslipidemia, in such conditions, definitely there is a point of ama which has to be considered, and the line of management needs to be focused more on that. And once we bring in that change through our panchakarma therapies, then we can think of dhatu pushti or rasayana therapies as a sustainable therapy, so that this whatever treatment what we have given is maintaining her health, and she is able to sustain the results that she has got. Also, a very balanced plan on well-being of the manas is very, very important in menopausal age. There, we've seen patients getting better with some of the yoga and pranayama and meditation processes.
Right. Thank you, doctor. I hope this query was answered well. There's another question. Doctor, weight loss can also be a reason of menopause. What can we do to overcome? I think she's talking about rapid weight loss or some extreme measures of weight loss.
Very rightly told. Most of the focus, many a times when we talk about menopause, goes on weight gain. But in some of the patients, we have seen that there is a drastic weight loss as well. Why is this happening? Is again, if the patient, if the women is predominant of vata, doing vataja ahara vihara, like too much of activity or too much of stress, too much of travel, all this can lead to weight loss as well. In these conditions, our focus should be more on giving that vatahara activities and vatahara diet, lifestyle, and maybe some treatments as well. like Abhyanga, followed by Shashtikishali Pindasweda. All this will help in doing the Dhatu Pushti as well as Vatahara action.
All right. Thank you, doctor. I hope the query was answered. There's another question from Dr. Deepika. Ayurveda advice on induced menopause. For example, hysterectomy is done for various reasons early on in life before even reaching the menopausal stage. So, in such conditions, what does Ayurveda say?
Yeah. So this is surgically induced menopause when a woman undergoes hysterectomy for multiple reasons. Might be because of some of the other conditions like fibroid uterus or dysfunctional uterine bleeding earlier in the life. She might have undergone a hysterectomy. Again, this is going to mimic the symptoms of menopause. So according to Ayurveda, the management again purely depends. We are not going to do a hormonal replacement. Again, we are not going to give estrogen or only phytoestrogen. That is not going to be a big solution for the women. So our lines of management will be totally focused on the dosha correction and also the involvement of dhatus which are gone haywire, or it is not just a replacement of phytoestrogen will not help this patient.
Uh, if there is any follow-up question for this, we can continue, else I will go for another question. So we have a question about perimenopausal period. If mid-cycle spotting is present and the respective investigations are normal, then how to manage?
So if it is in a perimenopausal phase, in some of the women, it is very common to see that there is a varied range of presentation of menstrual cycle. That is, there can be spotting for some days, and some cycles might be only spotting. Some cycles, the bleeding might be more. Sometimes there can be a phase of amenorrhea, and then there can be a phase of menstruation. So these are all the multiple presentations that we can see in a perimenopausal woman. In all these conditions, basically, wherever there is a variation in menstruation, if we focus more on pitta correction, then, and also most of the time vata is associated because apana vayu is a major has a major role in controlling all the menstrual and the reproductive activity. So planning our action towards the management of apana vata and pitta will help us get a better result in such kind of women or such kind of patients.
All right. I hope the answer was to your satisfaction. There's one more question related to HRTs that you had mentioned about. So, is there a way, or does Ayurveda therapy or does Ayurveda medicine recommend to start the treatment along with HRT, or someone who's already on HRT and still wants to opt for Ayurveda management? Does that work?
Can you repeat your question, Dr. Priyanka? I lost you halfway.
I'm sorry. Okay, so there's a question about HRT. Can HRT and Ayurveda treatment go hand in hand, or can do you have to stop HRT, or does Ayurveda say to not to go for HRT and just Ayurveda management, or can it be integrative?
Ayurveda therapy can be complementing HRT therapy. Ayurveda therapy can be standalone Ayurveda therapy. Ayurveda therapy can be also done after HRT because there are a lot of side effects that the women are going through when they are undergoing a HRT therapy. So basically, HRT treatment can be done through oral supplements, to vaginal supplements, to dermal patches. They can also, there are multiple ways of doing a hormonal replacement therapy. And most of the time, this hormonal replacement therapy is either estrogen, which is supplemented, or estrogen and progesterone, which are supplemented in a combination based on what is the requirement. If the uterus is removed, and in those patients, if there are menopausal symptoms, then it can be only estrogen therapies. So when only estrogen therapies are given, there are a lot of other side effects that the women undergo. So Ayurveda can be a complementary therapy along with HRT therapy. Ayurveda can be independent standalone therapy which can address all the symptoms of menopause, or Ayurveda can be one of the therapies after the HRT when the patient is undergoing a lot of side effects as well. So these can be the variants in which Ayurveda therapy can help a menopause woman.
All right. Thank you for answering that. We have a question related to oncology. So, some patients who have undergone post menopause for their chemo and radiotherapies, they get into health complications. So, what would be the Ayurveda interventions for such patients?
Health complications like, do we have much more details on that, Dr. Priyanka?
Dr. Rakesh, I would request you to rephrase the question or maybe add some details about certain health complications. Then we would be able to take this question again. In the meantime, there's another question about how does Ayurveda view emotional and mental aspect of menopause?
So, as we already discussed, there is a lot of wide range of psychological changes in that happens to a woman during the menopausal phase. It can range from a mild irritation to lack of focus to an extent of depression. So all this are because of the changes that the women undergoes, along with the contributory factors or the causes that are leading to that. So Ayurveda definitely helps the women during this phase. We have seen that certain yogas like Ujjaini, Shitali, and some of the pranayamas like Brahmari, these have brought in a big amount of change in the psychological changes in the women, along with, of course, along with some of the oral medication and some of the external treatments that Ayurveda offers, like Sarvanga Abhyanga, or the whole body massage to control the vata, and also a process called as Shirodhara, where the medicated oil is poured over the forehead to bring in that to relieve the stress and bring in that relaxation for a woman. So there are multiple options of treatment that we adopt based on what is the requirement or what is the presentation of a woman when we talk about the psychological changes in menopause.
Thank you for answering that, Doctor. We do have the follow-up question from Dr. Rakesh. So, the complications that he was mentioning, that they will have to undergo post menopause for chemo. So, the complications will be there. There can be multiple complications, is what he's saying. So, how does Ayurveda help in this stage? Like, what can be the interventions for someone for a post menopause due to chemotherapy and radiation?
Okay. So, if I understand, I think Dr. Rakesh meant to say that if there is a CA where the reproductive organ is involved and the patient has undergone a chemo or radiation therapy, and there is, of course, menopause, in that cases, what are the therapies that we can help them in? See, basically, in these conditions, as I told you, it can be a supplementary therapy because the disease process has uh, uh, gone to a stage where the patient has had a full-blown disease and has already undergone some of the therapies which themselves can have some complications or the side effects. So whatever the presentation is, based on that, individualized program will be developed for the particular patient and is carried out along with the diet and lifestyle changes that we advise for that particular patient.
All right. I hope Dr. Rakesh, Dr. Swetha has cleared your doubts. Another question that is very common nowadays, that women who are in their early 40s or even late 30s, they also experience certain menopausal symptoms, but they don't really act on it. So, what would be your advice to such women, and what necessary health checks or health interventions that they should do based on Ayurveda?
Yeah. These are the group of women who fall in the premenopausal phase that we discussed, where this can go from several years, 1 or 2 years to up to 10 years of phase, where women has some small symptoms. There is obviously a hormonal change happening. There might be some mild variation that she is seeing in her body, but it is not focused much, or it is not attended to because of the whatever lifestyle or the schedule that a woman has nowadays. So this is a phase when, if a woman can focus on her, if she can understand what are the changes her body is going through and bring about the small dietary and lifestyle changes, she can prevent herself from ending up having all the menopausal symptoms or the syndrome that we are talking about. So this is where I think a lot of awareness programs should be focused on, because women in their 30s and early 40s are the potential women who can prevent themselves from ending up having a menopausal symptom. So this is where a small change of bringing in yoga and meditation to their life, or bringing in just a oil application, if not every day, at least alternate days. See, if the patient is having too much of vata prakriti, then they can adopt, they don't have to go buy an medicated oil, even an almond oil, a little double bath almond oil, and rub it on your body on an alternate days basis. This will take care of the vata. If the patient is of a pitta prakriti, they can just use a sesame oil, which is easily available. So they can just double heat the sesame oil and have a oil bath on alternate days. This will help in preventing the pitta symptoms coming in. If the patient is of kapha prakriti, then they can use a mustard oil. So these are all the small changes they can adopt in their life. And as I told you, some of the activities also, if they are exposing themselves to lot of travel, a lot of say exposure to the AC or exposure to sunlight, all this are factors aggravating some of the doshas. So we need to be a little careful. If they're having a sedentary lifestyle, they can add in a activity or a regular exercise or yoga. All this will help preventing them from ending up in the menopausal symptoms, because as you know, the causes, when they pile and add up, this is when the disease starts manifesting. So this is the perimenopausal age, is the right age to focus on oneself, dedicate some time for oneself. As we might have always, we hear that there should be self love. So this is the right time for that self love, what everybody is talking around.
Very rightly said, Doctor. Just to add on to this follow-up question, what is the role of Panchakarma in perimenopausal stage?
Yeah. See, all the metabolic changes, they start setting in at this perimenopausal phase. So if we can bring in Swastha Vritta, is what we call in Ayurveda, because there is no, apparently there is no disease, but there are some changes the body is undergoing. So if we can support the body, and if we can give some of the panchkarmas to rectify whatever small metabolic changes that are set in the body, this will help the body in a long run to function normally and to prevent it from ending up in a disease. So definitely a wellness program for the women, or a total well-being program, including the psychological factors like yoga and meditation along with panchakarma, will be a very good line of management for a perimenopausal woman or a premenopausal woman, to prevent from ending up menopausal and postmenopausal symptoms.
Yes, thank you for that, Doctor. If there are further questions, I would request the attendees to ask them in the Q&A section. There's a question from Dr. Viraj. I heard these days women are facing early menopause in late 30s and early 40s. Is it correct?
See, yes, we have seen that the menopausal age is advancing, and we have seen as early as 35 women-year-old attaining menopause. These might be because of one is there is a genetic factor definitely in these kind of cases. Second is because of the lifestyle and the diet, and also the premature ovarian failure. All these are the factors which are leading to a early menopause in women. So as I told you, these women who are attaining early menopause definitely would have seen some of the small changes in their body during their perimenopause phase, but which might have been ignored and not attended to. If those changes are attended to, definitely we can improve the health of the women, and try to see that the transition between perimenopause and menopause becomes smooth.
Yes, I think Dr. Viraj, you got your answer. If there are any follow-up questions, please ask away. I would request the participants to ask questions in the Q&A section. You have a tab in front of you, which is a small question mark. You can type your questions there. Yes, I think, Doctor, we have covered almost all the questions. We still have, okay, we got one more question. How can we take care of women after age 50? What can they do to take care of their physical health after age 50?
So, in women who have attained 50 years of age, and there is obviously small changes happening in the women because her hormonal levels have varied. In these women, what we can do is we can give them some of the wellness programs, or we can give them some of the herbal preparations. Like most of the time, we can see that Shatavari, Arjuna, Yesti Madhu, uh, and even Trifala, because it is also one of the good rasayanas for all the three doshas. And these can be some of the oral supplements that can be given, along with uh, some of the small therapies like oil bath, or also some of the lifestyle changes like in ahara. We can advise the patient that they should not be eating too hot food or too cold food, or reheating the food, or indulging too much on spicy or oil fried food, because all these are going to affect one vata, pitta, or kapha dosha. So these can be one of the things. And also a regular small course of panchakarma based on their dosha, to replenish their dhatus and to bring in that metabolic correction. All this will help in women who have attained their menopause. And also taking care of the bone health is very important in the women who have attained the age of 80, attained the age of 50, and have are in the process of menopause, or in different stages of menopause.
Yes, I guess you got the answer, Dr. Viraj. Any further questions, please ask in the chat box. All right. I think, Dr. Swetha, we have covered all the questions. Those were asked till in the Q&A session. Just to conclude, those who have attended, everyone, the treatment guidelines or Ayurveda interventions, they depend on person to person. They are very personalized, and of course different for women in all stages of menopause. So no two women are going to have the same set of symptoms as well as the treatment. So, if anyone wants to consult or if anyone who is going through these phases and want to connect with Dr. Swetha, we have our phone number and email address to book your appointments. You can reach out to us and schedule an appointment with Dr. Swetha for the same. Dr. Swetha, last question.
Yeah.
Why is menopause called pause and not menostop? That's a very interesting question from Rajiv
See,
sir.
menopause is called. I'm really happy that we got this question because this is something very different from the regular questions. So this is very interesting. May I know who got this question?
This is from Rajiv sir.
Okay. So menopause is called menopause because it is not a total stop of the activities in a human reproductive system. There are a lot of other activities that the system is doing, but it is a pause because there is a pause in the release of eggs that are happening from the ovaries, and there is a pause of some extent to the estrogen that is being produced in the ovaries. So that might be the reason why it is called as menopause and not menostop.
That was a very interesting answer as well, Dr. Shweta, as well as the question was also very interesting. Yes, if there are no further questions, we would conclude this session. Thank you so much, Dr. Swetha, for joining us today and with your very insightful, informative presentation. I'm sure the participants who have joined us are really, they got good, knowledgeable information from you and they would be ready to apply this to whoever it is applicable to, all the women, especially those who have joined us today.
Thank you,
Thank you
Dr.
so much.
Priyanka. It was a very good session.
Thank you,
I
Doctor.
thoroughly enjoyed myself being a part of this session. Thank you to all the participants for spending your Sunday participating in this webinar. And thank you, AyurVAID, for creating such a platform where there is a interaction on most of the very crucial topics that many women tend to ignore because the symptoms are not very severe. As we discussed, it is very important to focus and take help. There is nothing that should stop you from seeking help, even if the symptoms are mild. Because as we discussed, there's a lot deep down which can boil down into some systemic diseases. So take control, get some help, and manage and take care of yourself and put yourself in a better health when you attain your menopause, and bring in that smooth transition instead of going through a rough phase during your menopause.
Yes, on that note, thank you so much, Dr. Shweta. And that is really a take home message for everyone, those who have attended. Thank you so much for joining in. Thank you, Dr. Shweta.
Thank you, Dr. Priyanka. Thank you.